If done properly, you should see the excess material squeeze through the locking holes built into the tray as shown here. Roll the putty into a cylindrical shape and place into your pre-sized tray. I always like to start with the easier lower arch to build patients' confidence in the impression-taking process. Shape the material and then place the pre-cut plastic square over it with the centerline cut in the open space that the tongue will occupy. Place the entire formation in the mouth, press to seat as much as possible with hand pressure, check and make sure that the lips are out of the way, and then ask the patient to bite with firm pressure on 2 cotton rolls that are placed bilaterally at the first molar. If done properly, you should see the excess material squeeze through the locking holes built into the tray as shown here. Once the material stops squeezing out, ask your patient to open and immediately remove the impression tray. What we have created here is basically an immediate chairside custom tray. Since the material is still viscous, use finger pressure to remove any undercuts and form higher walls or troughs if desired. Now the plastic sheet can be removed and I have a VPS custom tray that is not only set, but largely free of saliva integration. One more common challenge with 2-step impressions. Moving on to the wash phase, I choose Capture medium body syringeable material. I prefer the medium body in this situation because it is going to make up the bulk of my accurate anatomical impression, so a bit less viscosity is beneficial. Extrude the wash into the tray while keeping the mixed tip buried in the material to prevent air bubbles from getting trapped and forming pockets. Fit the tray back into the mouth and seat into place. Since our initial putty phase did not render undercuts or tight areas, our worries of double impressions are an afterthought. This chairside custom tray is also preventing excess from oozing out and into the patient's throat. At this stage, hold the tray in place with finger pressure and never by asking the patient to bite on cotton rolls or anything else. Our impression comes out clean and without error, so we can move on to the opposing arch. In this demonstration, I'm using a metal tray for the mandible and a plastic tray for the maxilla. During an actual treatment, I tried to stay away from swapping trays between metal and plastic and stay true to one product.